Well, hello ladies and gentlemen. My name's Julie McCrossan and it's my great pleasure to welcome you to this second webinar consultation in our special series on how can we improve the radiation experience for patients and families. And this series is hosted by SAHMRI, the South Australian Health and Medical Research Institute, and the Australian Bragg Centre for Proton Therapy and Research, which is being built in Adelaide as we speak. As I said, my name's Julie McCrossan, and in 2013 I was treated for stage 4 oropharyngeal cancer in my tonsils, tongue and throat, with 30 sessions of what's now referred to often as conventional radiation therapy and also chemo. And I'd like to begin by acknowledging that we're broadcasting to you today on Aboriginal land. I'm in central Sydney, so I'm on the land of the Gadigal people of the Eora Nation, and I'd like to pay my respects to elders past and present and emerging elders. Can I also just quickly share with you the purpose of these webinars? Essentially what we're doing is sharing examples of how conventional radiation therapy teams and proton therapy teams, this is a different kind of radiation, how across Australia and internationally these teams are seeking to improve the patient and family experience. And we're asking you to tell us through the chat function, and I'd love you to go to chat throughout this webinar, putting your thoughts on how we can improve the patient and family experience, and also your thoughts on what's useful in what you're going to hear in a moment from people at the Christie in Manchester in the United Kingdom, and also from Princess Alexandra Hospital in Brisbane. They're going to tell you some of the things they're doing. Well, you let us know through the chat button what you think are good ideas. We're seeking to inform the development of the Australian Bragg Centre, and we're also seeking to just spread good ideas in the hope that lots of cancer teams can have a go at things they may not be doing now that they think are worth doing for the sake of the patients. We'll also send you a survey in the next week or so, enabling you to put your comments in that survey. And we'll have 3 more webinars next year, one of which will be a webinar report on all we've learnt, with lots of commentators telling us the best ideas we've heard. And today we'll have some commentators as well, including a representative from Rare Cancers Australia, who are co-hosting or co-sponsoring our webinar today. So let's begin. Here's the Executive Director of the South Australian Health and Medical Research Institute, SAHMRI, Professor Steve Wesselingh.
Welcome to this webinar series where we're going to focus on how to improve the radiation experience for patients and their families. I'm Steve Wesselingh. I'm the Executive Director of SAHMRI, and SAHMRI is one of the organisations that's working in a partnership to bring proton therapy to Australia and to South Australia. The Australian Bragg Centre for Proton Therapy and Research will be the first proton therapy unit in Australia and the most advanced proton therapy unit in the Southern Hemisphere. SAHMRI, the Federal Government, the South Australian State Government, the project manager CNG and the builder Lendlease are all working together to create this proton therapy centre. This is really important because what it will do will enable Australian patients to get this life-saving treatment in Australia rather than having to travel overseas. This treatment is particularly important for children where it can target tumours in really difficult areas and not damage surrounding tissue. Construction of the Australian Bragg Centre has begun. It's designing a safe, welcoming and comfortable environment for patients who come to the Bragg Centre for proton therapy is more than just building a building. That's why we're talking to you. Cancer survivors, families, patients, clinicians, we know that you understand what's needed. With your reflections and experience, we can create a truly outstanding proton therapy centre that is comfortable and safe. And not only that, we can share those findings and those developments with the broader community. Thank you for taking the time to be part of this conversation, for giving up your time to help us improve the experience for patients and their families.
And I'd just really like to thank SAHMRI and Professor Steve Wesselingh for supporting this webinar consultation, highlighting the need to improve the patient and family experience. I'm also acutely aware that we have people watching from New Zealand, and I promise you that in our webinars next year, 2021, we'll address the question of whether our New Zealand cousins will be having access to this Australian Bragg Centre for Proton Therapy and Research as well. I think many discussions are still taking place. But ladies and gentlemen, let's travel now to Manchester in the United Kingdom to the Christie NHS Foundation Trust. So, John, welcome to our conversation about improving the radiation experience for patients and families. And of course, you're working with proton therapy. Can you just, your title is Clinical Service Manager, Proton Beam Therapy, the Christie at Manchester. What is your role and what are you fundamentally responsible for in your clinical background?
So clinically I'm a medical physicist by trade, but these days I'm essentially an operational manager, so I kind of make sure that the whole service that ticks along operationally and that we can deliver the kind of safest and most efficient service for our patients that we possibly can do.
I know that you're quite passionate, aren't you, about leadership and patient-centred care, and you've done a lot of research in that area, but I'll focus now on the proton therapy, if I may. Here in Australia, it's new to us here. What is proton therapy, and what are the main patient groups you've been working with in this, the first proton therapy centre in Britain?
I know this sounds very basic, but it's another version of radiotherapy, and quite generally, the principal aim of radiotherapy is to deliver as much radiation to the tumours that we target as we possibly can, whilst minimising the impact on the healthy tissue in the body. So proton beam therapy in that context, it uses a different type of radiation, so it uses proton particles to deliver that, and kind of the physics and the nature of that particle is such that it can deliver it in a much more precise way. And when I say precise, I mean it can deliver much more radiation to the tumour whilst sparing the tissues around it. So in terms of the types of patients that really offers benefits for, you can look at it in very basically two different ways. The effects of radiation on healthy tissue are usually latent effects that kind of onset over a number of years. So minimising the radiation dose to healthy tissue means it gives loads of options to paediatric patients which didn't have a radiotherapy option in the past. So proton beam therapy, compared to conventional radiotherapy, has quite a significant uplift of paediatric work that it does. But I suppose adults are still the bread and butter of what we do, and for them it's very different. We treat a lot of tumours that lie relatively close to and adjacent to really sensitive tissues. So we treat, at the moment, we're treating indications for sarcoma, for example, head and neck tumours, neurological tumours, and that's kind of a selection of those tumours which, you know, lie adjacent to sensitive organs, if that makes sense, and sensitive tissues. With paediatrics, it's much more general because you're looking at it from the different context. You're looking at the rest of the life a paediatric has to live and minimising the impact of radiotherapy on them for the rest of the life. So it is much more general from a paediatric perspective. But we're currently working up indications like lymphoma and neuroblastoma, for example.
My understanding is that your guiding principle is happier patients are healthier patients. And what I'd love is just 2 or 3 examples of how you translate that into the actual experience of the Christie. What happens when the patients come in the door, what they see at reception, what the design is like of the waiting room. You know, give us a sense of how you keep them happy.
Well, that's a really good question. We've had a glorious opportunity of designing a service with a blank canvas. As a national service, where we displace patients nationally from where they live to the other side of the country, we need to kind of reflect in the way that we provide care the challenges that they may face. We want it to be home from home in many different ways. So a really good example is how we accommodate the patients. You know, we retain that guiding principle that radiotherapy should be, where possible, to be provided on an outpatient basis. But also, when someone is spending a significant block of their life away from home, we don't want that to infer the feeling of being an inpatient. So obviously we have to accommodate these patients. We did think about accommodating them adjacent to the Proton Beam Therapy Centre, but we actually took the decision to accommodate them in the centre of Manchester, which is, roughly 20 minutes up the road. And because that means they are not reminded that that's what they're here for, proton beam therapy. They're not reminded that they're here to be at the Christie, and they've got all the wonderful facilities that Manchester offers as kind of the second biggest city in the UK at their doorstep. We want them to have a life as normal, and we want them to kind of find as much routine as they can and do as much stuff as they can with their family, and not be consumed for 6 weeks by this concept of being a patient.
And so you have a shuttle bus, as I understand it, that sort of travels back and forth between the centre of Manchester and the Christie.
Yeah, that's absolutely right. So, if you thought about it rather superficially, you could say, right, we're going to accommodate you in the centre of Manchester, make your own way down. But it is the little things that make a difference if you're going to embrace that happier patients, a healthier philosophy. So, as part of our accommodation budget, we built in that shuttle bus. Now, as we alluded to just a few moments ago, a significant number of our patients are paediatrics, and to be able to provide a specific paediatric service, we need the support of the Royal Manchester Children's Hospital. So we have a shuttle bus which stops routinely on a round-robin basis between the accommodation, between the Christie and between the Royal Manchester Children's Hospital, where they might jump off the bus and go and get their concurrent chemotherapy, for example.
Just while we're staying with the fact that you've got families, including families with children away from their normal environment, you've got a school as well. Again, just concisely, how do you arrange the schooling, and why is that important in a cancer centre?
That's a good question. I mean, we were very lucky to receive some funding from the local education authority for the implementation of schooling at the Proton Beam Therapy Centre, and then that was implemented by an organisation called Manchester Schools. The why it's important is the good question, because superficially you could look at it as us doing our part for the education of these children, but it's much more than that. School for them is another distraction, just like all the facilities close to the accommodation. It's another distraction. In many ways, it's an anchor to their normal life. So it gives them something to occupy their mind, and I think that's why it serves a really important purpose here, more than just maintaining progress with their studies, which is the most superficial observation.
It's a wonderful expression, an anchor to their life. What I'd like to do now, if I may, is move in a reasonably concise way through some of the physical features that you've got at the Christie. I know you think the front desk experience is important. So what is your goal with the front desk, both in terms of what people see as they enter, but also your recruitment and training of staff? What are you aiming for there?
Well, the key to the front desk is more than just the things that spring to mind, the administrative, the logistical aspects of somebody working on a front desk. We have clinical support workers that work on our front desk. And to really understand that, what you've got to do is take a step away from what you know about radiotherapy. We ask patients to attend a hospital on an outpatient basis every single day for 6 weeks. Now, if you take your radiotherapy hat off, that is actually quite mind-blowing, isn't it? And the reality is, every single one of those occasions, so 30 occasions say, the first person they see when they walk through the front doors are the people on the front desk. So in many ways, yes, they've got those administrative and practical functions, the clinical support workers, but more importantly is their role to foster a good relationship with the patient, to make them feel happy and engaged and less anxious every single day when they walk through those doors. So yeah, when you talk about the amazing people that work in radiotherapy and work in proton beam therapy, you can think of your clinical oncologists, the radiographers and the physicists. But in many ways, our clinical support workers are some of the most important people in the building.
People who are watching this, some of them are building a proton therapy centre in Australia right now, and they're very interested to hear how you designed your internal look in order to achieve certain experiential goals with the patients and family. I know you've got something called the Winter Garden that also has a kitchen and that can you describe the design features? What sort of feelings are you trying to induce in the patients and family as they come to the Winter Garden?
Well, it would be easy to take credit and for the wider team to take credit for the Winter Garden when I describe it, but I think it's important to recognise that all the ideas that are kind of encapsulated that I'll describe now came from patient engagement. We asked patients that had been to Jacksonville in Florida what was good about proton beam therapy in Jacksonville. And one key piece of feedback was it felt more like a hotel than a hospital. So when I refer back to earlier in the conversation, we are displacing people from home. That is a really good piece of feedback. So that manifests itself in the Winter Garden. It's got great big windows where the light can come pouring in. Light affects our mood. I know right now it's winter in England and mood has dropped significantly. So that just gives you a great example of how important light is. We have a green theme, so we've got trees in there, both in terms of the decor and an actual tree in the Winter Garden. The colour green is well known to lift spirits and make people feel a lot better. But also the layout of the seats is important. We've all been to the classic healthcare provider waiting room where we've sat in squares or in rows. What we've tried to do with the seating arrangement in the Winter Garden is to remove that formality using cluster seat arrangements, and quite often you come down the stairs looking over to the Winter Garden and it looks more like a shopping mall, like the kind of place someone would spend their leisure time than the kind of place someone would sit and wait for radiotherapy. And psychologically, I think that is a really important factor. Sometimes I come down those stairs and I'll see a complementary therapist perched on the end of one of these cluster seats, speaking to a patient or their family. Now, that for me is fantastic. We're engaging with that family there in that kind of informal setting as opposed to the more sterile clinical environment. So that can only promote patient engagement and make them feel happier and healthier.
You've essentially created a space where the staff want to go too. You know, it's a nice space to work. It
is, and everyone feels great, takes great pride, they enjoy being in that environment, and certainly with the kitchen facilities on a Friday, our clinical support workers will often host a coffee morning. And when you kind of look at that waiting room environment and you're sat next to Mr. Smith that you've never met in your life, you can suddenly start chatting to Mr. Smith over a piece of cake and a coffee in a way that you wouldn't do if you was just sitting there for your radiotherapy. Similarly to that, we encourage the staff that are operationally available to go and take part in that coffee morning too. And much like the complementary therapist, it's really good to build those relationships and that engagement in that informal setting than just seeing your radiographer on your treatment fraction day in, day out. That's really helpful too.
And why is the notion of cluster seating important rather than the rows or staring at each other in a square?
It's informal, isn't it? I think that's the key. Delivering radiotherapy could not be more formal as a healthcare intervention when you think about it. You go into a treatment room, quite often you are immobilised in one way or another. It's for a very good reason in terms of safety and the effectiveness. It's as formal as you can get. So actually, we're trying to do the opposite in the waiting room scenario and remove that formality. You know, even with those cluster seating, you do not have a designated place for your bottom. You know, maybe we do in the current environment, obviously to facilitate social distancing, but that as well, psychologically, is something very different. It's a more laid-back way of thinking and waiting for your radiotherapy.
Let's just come to, while we're on this issue of design, to the design of the anaesthetic system, because I think you're both proud of your equipment and I think you're a centre of excellence with specialist teams, but you've also gone for a certain approach to room decoration with animals and a proton panda, which of course I just have to hear about. So tell us about particularly the design, because there's architects listening to you now and saying, you know, what are you doing to put your paediatric patients at ease and also clinically safe?
When you deliver general anaesthetic in the context of radiotherapy, in many places you can perceive the GA bit, the general anaesthetic bit, to be a bit of an add-on. However, all day, every day, we have patients that are asleep. You know, at least one, sometimes two. And And GA is an invasive procedure. You know, what is GA? You're putting someone into sleep and letting a human being manage your airway while you're asleep. So we have to be really proactive around our patient engagement. And as you've just alluded to, Julie, the design of the department was a big part of that. Obviously, we're putting paediatrics under general anaesthetic, so we have an environment that's geared towards that age group. We have an animal theme that runs throughout the pathway, from the paediatric waiting area into the induction room, into first and second stage recovery as well. And that animal theme is consistent. It features as its main character the Proton Panda. And actually we have an app that goes side by side. So in those 2 to 3 weeks between your single assessment visit and you starting radiotherapy, you can walk through the anaesthetic pathway guided by those animals. So it's a very engaging way of getting someone to adjust to an environment which will become second nature and ease the process of undergoing general anaesthetic.
And just very concisely, when you say animals, why are there varied animals? Can you explain that?
Across our range of paediatrics, although we only GA the very young ones, we see an immense amount of diversity. So, you know, you could have one child 1 week that would love a giraffe as opposed to a panda. So you'll see a giraffe in a hot air balloon. If you go into the induction room, we bring the underwater animals to life, and the induction room's set up like a submarine, and you'll see the squids and the fish swimming around the induction room, which is quite apt in the whole scheme of things. So for them, it's a little bit exciting. You know, of a weekend, you would take a child of that age to a soft play area with a similar theme. Why not Monday to Friday whilst they're having the general anaesthetic? It's very engaging outside of the kind of their healthcare. Why not have it within their healthcare?
Fantastic. Let's move now, if we could. We don't have a lot of time left, but the teenage lounge and the nights out. So there, obviously, you're dealing with your adolescent, young adult patients. What's the lounge all about? What does it look like? And what are the nights out?
As well as paediatrics, we do teenage and young adults, which picks up at the age of 13 and carries through to 24. But when you look at the paediatrics and TYAs combined, anyone who's got a child out there or a young adult that they're responsible for will know that kind of gradient of maturity is so steep, it's incredible. You can have a 12-year-old who walks around like they're a 21-year-old, but you can have a 12-year-old that very much feels like they're much younger than that. So it kind of aligns with that diversity theme. Again, we need to have a facility that can respond to the different levels of maturity from very young to 24. And that's where the TYA lounge comes in. That's for those kind of mature young adults and teenagers that don't want to be playing underwater with squids and fish, you know? And actually, the winter garden's very nice, but do they want to be surrounded by adults all the time? Do they need to be even more relaxed? So yeah, if you could picture a bedroom for a young adult or a teenager with a games console, with interesting books relevant to that demographic, that is essentially what our TYA lounge is all about. And it's supported by the Teenage Cancer Trust as well. We have a youth support coordinator that works with that charity who, you know, has got a lot of really pertinent advice for people of that age, things around sexual health, for example, completely unrelated to the radiotherapy. You know, again, they are still teenagers. They are not defined by their diagnosis. They are still teenagers and have the same requirements as if they were if they had not had that diagnosis. And that takes the environment on another level. But furthermore, the Teenage Cancer Trust Youth Support Coordinator will facilitate support for them outside of their treatment schedules as well. We provide things like yoga therapy. We'll tend to have pizza nights when we're allowed to. We'll go temping bowling and crazy golf. And again, it's all part of that engagement exercise around what they're subjecting themselves to whilst displaced from home.
If you send me a Proton Panda, I'll send you a kangaroo.
An actual kangaroo. I'll see what I can do for you, Julie. If you want a Proton Panda on camera, one of our play specialists is literally walking past as we speak. could you grab us a Proton Panda?
Yeah.
Would that be amazing?
Anything else?
No, thank you. That's everything. Thank you, Charlotte. Proton Panda incoming.
What's fascinating to me is that you're a medical physicist. You know, you are so sensitive to the psychological and the emotional well-being of your patients and their families. How is it that you've embraced this kind of leadership role? Just quickly, personally, what is it that attracts you to this role?
I think I've inherited a set of values from my mother, who was a nurse, that drive me to be passionate about helping people. And I think for me, the way I can help people is through people. And, you know, when we talk about starting with a blank canvas and the holistic needs of our patients with proton beam therapy, to meet those holistic needs and those diverse needs that we've picked up on in the interview, you need a diverse team. So ultimately, to make that work, you need to be able to engage nurses in this just as much as you engage radiographers, doctors, anaesthetists, etc., etc. Now, those professions attract very different personalities. So you need to be a people person to make things tick. And I enjoy building relationships with a diverse set of people, which are bi-directional in nature and help me get the most out of our team and help our patients have the best possible experience.
Look, I think a Proton Panda might be nearby.
So Charlotte, who's one of our health play specialists, has just brought over one of the Proton Pandas that we talked about before. So if I bring him a little closer.
Let's come and say hello to the play therapist. Can we just meet her for a moment?
So this is Charlotte, who's our lead play specialist. Take a seat. And this is Julie.
Can I just ask you, how do the children react when they get the panda? Does that panda play a role, do you think, in the conclusion of their treatment, how they feel about it all? Tell us.
Absolutely, yeah, definitely. So this panda goes in a little welcome pack that we give to all patients when they come. So they get a panda and they get a little information book that we've written with input from previous patients to give them lots of the pictures of the environment and meet the team kind of information. So and they get some little treats in there as well for when they start out. And this panda very often goes with them for their scans, for their mask making if they need one, and for their treatment in the gantry. And it's very often a little mascot that they hang on to each day when they go in. So yeah, they're often very, very treasured.
That little bear is going in when they have their mask made, when they go and learn to lie on the bench and have the proton therapy delivered. It just goes on the journey with them. Just one last comment, if I could, and thank you for just jumping in like this. Play therapists play a big role in cancer care for young children in the United Kingdom. Just give us 2 or 3 examples of what you're doing with children all the time that you think really helps them in the experience and why you should be part of the team.
So we're health play specialists is our title here in the UK. So one example, I guess, if we look at the Proton Panda's role, especially with younger children, is we have patients here who are on a dual pathway, which basically means that they come for assessment for their first week. And we work with them and the family really closely, and we're really part of that decision as to whether they'll manage their treatment awake. And play is a really, really important part of that, because it's a way of assessing where children are at, because children tell us a lot through their play, and it's a really good way of engaging with them, because that's what makes them feel comfortable, because it's kind of in their DNA as children, and actually as adults, but that's a different conversation. And kind of Proton Panda can, for example, go on our model gantry that we've had made in-house.
So members of your team have made a model of the proton therapy machine that the little bear can go on, and that allows the child to see what's going to happen.
Absolutely, yeah. And when they play, we can observe them and pick up any little questions they have or anything that they're not sure about, and then we can work with them through that and help them manage their treatment awake, even at quite young ages.
Well, look, thank you for joining us, and I just want you to know that John has promised that if I send him a kangaroo, he will send me a proton panda. So I just want you to be the witness to this contract, if you would. And I'm so grateful you spoke to us here in Australia. Thank you.
Thank you. No problem at all. That sounds like a good deal to me.
And John, I just wanted to thank you so much for your just for everything that you've said. I think it'll be incredibly useful to us here in Australia. So thank you very much, and the kangaroo's in the mail.
Thank you. The panda will be coming via Qantas any day now. See you later.
And I want to thank the incredible people at the Christie, John and Charlotte, and the people behind the scenes who, in the middle of a pandemic, in the middle of lockdown, agreed to share their great work with us. I'm just so grateful. And the picture of the little panda on the little mini proton therapy machine came through about 8 hours ago in the middle of the night in Australia. So thank you so much to Charlotte, who went to great lengths to get it. Look, if you've just joined us, this is a webinar consultation looking at how to improve the patient and family experience of radiation, including the new proton therapy. If you want to look at our first webinar, which featured the Danish Centre for Particle Therapy and the Peter MacCallum Cancer Centre in Melbourne, just Google via YouTube SAHMRI, SAHMRI, SAHMRI Bragg, BRAGG, and it will come up, and we'll be circulating it like mad in social media. So look, I'd now like to welcome 3 commentators before we travel to another place, Princess Alexandra Hospital in Brisbane. But let's just reflect a little bit on the Christie. Welcome to Professor Phyllis Butow from the School of Psychology at the University of Sydney, and Phyllis is a renowned researcher into the experience of cancer care. Welcome also from Bagot, one of the team working on the internal design and other aspects of the new Australian Centre for Proton Therapy and Research, Rosina Di Maria, who's a principal with Bagot, and Associate Professor Peter Garayski, a radiation oncologist from the Royal Adelaide Hospital. Welcome to all of you. This is the clapping way that you applaud each other. Rosina, let me come to you first. 2 or 3 things that you found thought-provoking, useful in the Christie experience.
Yeah, I think that was wonderful, and it's certainly ingrained and aligned with our thinking that instead of designing a space for patients, our role is to design a space for people. And all people need the same things. We need to feel comfortable, we need to feel safe, and we need to feel welcome. And so our role is to really understand what that means through the eyes and lens of a child, an adolescent and an adult, and craft spaces that help people respond in a physical and mental way. So that was really important. And I think it was just so special to learn about the small human touches which help build that confidence with patients and care, and actually put the emphasis on the happy, which was a really nice thing as well.
Can I say, you were with us last week when the people at Peter MacCallum talked about Ilana Berger, the social worker and working with the adolescents and the young adults. She talked about seeing the design of internal spaces through a developmental lens. And I think that was very much, again, what was coming from John Archer there at the Christie. Could you give us a couple of examples of what you've seen or that you're thinking of yourself that take into account this notion of the different levels of maturity of younger patients?
I think it's a really good point. But it also starts with an overarching theme of creating a total space environment that really has quality at its core and crafts every human need response. So for us, biophilia is something that we're really interested in, which is the use of nature in environments, because all people respond well to nature. And so there has to be a single sort of brand that overlays all the spaces and ties all the spaces together. But then I think it's the focus in those different developmental stages that take you to the next layer and level of exploration in a space and how a small child would respond. And I think it helps, from our point of view as well, we analyse profiles of different people. So it's really important for us to see that world through those lenses. So from a small child and having waiting spaces that allow mothers to nurse or to keep an eye on other small children if they're coming with other family members or siblings, right through to how the adolescent actually feels that they need more privacy, that their emotions might, it is a different experience from their point of view. They might have to have travelled different distances. So creating spaces that they can retreat to but still feel connected is something we're very interested in.
Now, I'll just ask you one more thing, if I may, and it's just a personal comment because I'm into practical specifics. Sure. And one thing I've noticed so far is that all the front reception desks are very high. And I was originally a primary school teacher, trained as a primary school teacher, and I was attracted to the small furniture. And I also know that many people who have cancer and who are in treatment spend a little bit of time in wheelchairs. So both children and people in wheelchairs are low. And so even in the wonderful centres we've seen, if a child or a person in a wheelchair comes to reception, and I notice how John Archer really emphasised that importance of the welcome, which as a patient I couldn't agree with more, but I've never seen a reception desk that isn't high. And I wonder if we need a desk that has a little low bit so that if you're arriving with a little person, you could sit and talk to them eye to eye.
It's interesting you say that, Julie. Well, you can join our design team anytime, but in fact, we have responded exactly with that. So let's talk about demographics also. So a very elderly person, it needs to be recognisable instantly. So they need to feel they can get there without sort of the pathway being interrupted. So they need to see it. But we have definitely designed the desk to have both of those elements because openness and lowering not only helps the practical sense, it's the mental approach of actually I can cross that barrier by asking questions. I feel like I'm actually, there's not a separation between us. So we've designed both.
Excellent, and I just mentioned too, because I'm 66 and arthritic myself, that when you're unwell, it's quite nice to sit down at reception sometimes if you have to wait for a little while, and you often don't see chairs there. So I'm just being nitty-gritty because I remember this so vividly. But
it is the detail that counts, though.
But we'll meet you again at the end of our conversation. But Professor Phyllis Butow, if I could come to you, our cancer researcher from University of Sydney. Phyllis, 2 or 3 comments that struck you as really interesting, thought-provoking, valuable.
Well, I think one of the things that really impressed me was that they had created a position like John's and several positions underneath him which really focus on improving the patient experience. Because I know from my own experience of trying to develop better services for anxiety and depression that unless a service is adequately resourced with staff and time, the existing staff, with the best intents, really struggle to take on the extra work over and above their duties. So simply having those positions in place is really impressive. And I think they really understand that it's the human relationships and interactions which make people feel at home and comfortable. So having those support staff smiling at you as you enter reception each day for your radiotherapy or proton therapy, having staff come to the Friday coffee sessions to really meet patients as human beings rather than just staff. Those things, I think, would make an enormous difference to the experience of people in a centre like this.
Could I ask you too about the role of Charlotte Cooper, who fortuitously came in with a proton panda at the end? These health child therapists. My understanding in the United Kingdom is they're fundamental to the team when it's a children's cancer service, whereas I don't think we routinely have them. We have them sometimes, but mainly they rotate and people just get brief opportunities for training. So your thoughts there on that role in the cancer team?
I think in a centre which is providing services to children, that play therapists are essential, and I think she made that point in saying that that's the natural way that children communicate and engage with their surroundings. So I know that in some of the large children's centres for cancer, they do have play therapists as an integral part of the staffing, but certainly in other services, particularly for those that cover adults and children, a play therapist may not be so central to the staffing. So I think that is really critical. And as she said, it helps them to assess where the child is at and what they might be needing to better be able to provide services that meet those needs.
Look, thank you very much, Phyllis. And if you're watching this now, whether live at the moment or through YouTube, and you have views on anything that we're discussing, but particularly on this question of the role of play therapy for children, because for the new Proton Therapy Centre, the Australian Bragg Centre for Proton Therapy and Research being built at the moment in Adelaide, children are a key recipients of proton therapy. This role of caring for children is very important, and we're going to work out a way to allow you to send us information via YouTube, because many more people will watch this on YouTube than in the live webinar that we're doing right now. But let me come to Associate Professor Peter Gurayski, a radiation oncologist at the Royal Adelaide Hospital. I've got a question for you, Peter, but before that, the 2 or 3 things that really stood out for you in what you saw at the Christie.
Yeah, thanks, Julian. Hi, everybody. Look, before I answer that, I just want to point out something, and that is a big thank you to you, Julie, for your tireless efforts as a cancer advocate. So really, I'd like to highlight that before anything. So there are 2 or 3 things that I think were really exciting to hear. Was this concept of using light and colour. And, you know, I'm a radiation oncologist, not an architect or an interior designer, but clearly there must be a science basis behind all that. And there's a psychology that must be known and studied about the effects of environment on patients and well-being. So I'm very excited to hear about that. I was actually lucky enough on 2 occasions to visit the Christie, so I've seen this firsthand. It is a light-filled, warm place that indeed does look like a hotel, not like a typical hospital. The other thing I'd like to say is I was very interested in this concept of separating young children from TYA, or in Australia we call them AYA, so the teenage to young adult population. Their needs are actually very different. And so the younger children that required general anaesthetic for their therapy have this wonderful animal theme that they embark on with Proton Panda and other characters. I thought that was very clever. And then with the AYA group, of course, they have very different needs. And I really liked how John made the comment that the facility needed to respond to their different levels of maturity, and how that cannot be as obvious as it may seem. Like he mentioned when he said a 12-year-old may be as mature as a 21-year-old, but also the reverse can be true.
I'll just say, Peter, I'd also like to emphasise the use of that model proton therapy machine. It's a scale model using the same materials, an exact model of what the child or indeed adult will lay on to get their treatment. And it was made by an engineer within the Christie team. A similar scale model is used for radiation therapy at the St James University Hospital in Leeds. I am so keen about models, I travelled to Leeds just to see it, and it will be on our YouTube channel for you to have a look at as well. And most radiation therapy, and it'll be the same for proton therapy people, don't get to see the room they're going to be treated in before the first session. And I think it's so unusual. Unless you see it, you don't understand. So I'm a great advocate of models, not only for paediatric patients, but for adults. So I just put that in. It's a personal passion. But Peter, just before we travel to Brisbane, I think it's so important that we emphasise that while we are looking at proton therapy centres internationally, because the Australian Bragg Centre for Proton Therapy and Research is currently being designed and built, and our architects are with us, it is important to make clear that for many, many cancer patients for many years to come, what is called conventional radiation therapy will be the best treatment for many patients. And indeed, it's modern, sophisticated, highly targeted radiation therapy is a very, very effective treatment. I myself had it, and here I am after a stage 4 throat cancer. Is that an important point to get across in these webinars?
I think that's absolutely critical to get right in these webinars. Make no mistake, modern radiotherapy, which is, we're using the term conventional treatment, is quite literally a marvel of modern physics and technology advancements. Radiotherapy these days, which is readily accessible around Australia, is very, very targeted. And we in Australia are actually some of the world's leading technologists when it comes to highly conformal targeted radiotherapy. So no patient or their loved ones watching this should forget that their healthcare providers have access today everywhere in Australia to highly sophisticated targeted conventional treatment. Proton beam therapy is merely a different way to deliver radiation. Dose is dose, as we say, and it's only select patients that will benefit from the unique physical advantages of particles over conventional X-ray therapy. You can access proton beam therapy as an Australian before our centre comes online in about 3.5 years through something called the Medical Treatment Overseas Program. But your healthcare providers will know about that. And so any patient having question marks about treatment that they've had in the past, or indeed treatment that they may be embarking on, needs to remember that the vast majority of patients will be well treated by conventional radiotherapy.
Thank you so much, Associate Professor Peter Garaysky, Rosina Di Maria from Wood Bagot, and also Professor Phyllis Butow. And let's travel now to Princess Alexandra Hospital in Brisbane, Queensland. Well, it's such a pleasure to introduce Dr. Bena Brown, Principal Allied Health Research Fellow in Cancer Care and an advanced speech pathologist at Princess Alexandra Hospital in Brisbane, in Queensland. Well, at least you were until a few moments ago. You've now gone to the Menzies School of Health Research. But how long have you worked prior to that at Princess Alexandra in Brisbane?
I started working here as a new graduate speech pathologist in 2002, so it's been 18 years that I've been here at PA before I moved to Menzies.
And how much time have you spent with patients receiving radiation?
I started in radiation oncology, working down here in 2005, so it's been 15 years of my life, which I've enjoyed every second, and during that time I also did my PhD in radiation oncology.
And the nub of what that PhD was about?
It was about looking at how people coped with their treatment in terms of the functional outcomes of head and neck cancer treatment, so their swallowing, their nutrition, quality of life, and patient-reported outcomes between two different types of radiotherapy treatment, so altered fractionation radiotherapy and chemoradiotherapy.
And one thing you've been doing is called Health My Way. What is that, its purpose, and how does it work?
Yeah, My Health My Way is an electronic web-based patient-reported outcome tool. So in cancer research over the last couple of decades, there's been a real push to hear the patient voice and hear the family voice during their cancer treatment, because it adds so much value to the care that we provide. So My Health My Way is a way for patients and their families to connect with their healthcare team. So patients enter their data of how they're experiencing treatment onto an app during treatment, and that directly connects with their healthcare team. So referrals are made to different members of the team based on the information they enter.
If you could describe the waiting area where people are waiting to have their radiation treatment, we've often got family members with us. Where is this capacity to enter information about yourself, and 3 or 4 examples of the sort of questions you're answering?
So there's 2 different ways that people can enter their information. One is on a stand-up podium, so it looks kind of like an ATM machine in our waiting area. So patients and their families can come up to the screen. It's a touch screen. They can enter their data that way in the waiting room of our radiation oncology department. Or alternatively, people get sent out a personalised SMS message to their own device, so they can also complete their data in the comfort of their own home or when they're out and about. It doesn't have to be in the department.
So give me a sense of what sort of things I'm telling you as a patient, whether I'm doing it on the pedestal in the waiting room or on my phone at home.
So you're telling us information about how you're physically experiencing treatment, so any physical side effects you have related to pain or nausea or a whole range of different physical things that are specific to your cancer type. You're also telling us how you're managing at home practically, as well as how you're managing emotionally and how you're getting on with your family members and relationships with other people, as well as your experience of distress and things that might be contributing to that distress.
As you know, Bena, I have an interest in distress because I found the experience of radiation treatment with the mask tough. So if I was filling in the podium in your waiting room while I was waiting to go in, and I said that, you know, while I was in the mask, I was sweating and going red and the heart was going fast, what would happen? What would happen after I reported that?
So there is a specific question that relates to mask anxiety on our tool. So people can tell us about their general anxiety, but separate to that, people can explain their experience of mask anxiety. And if your mask anxiety is at a level that is severe enough, then a clinical alert, as soon as you press enter on your data, a clinical alert gets sent directly to our occupational therapist and radiation therapists, and they're aware then from the moment that you enter that data that's what you're experiencing. So automatically a referral would be sent to those health professionals to support you during your treatment.
This is all about how to improve the patient and family experience of radiation. How does this Health My Way system improve the experience for the patient but also the family?
So we have also validated the tool for carers and family members. So there's a separate tool that carers can complete alongside the patient. And it also allows then, if the patient is doing really fine and the carer or the family member is having a hard time supporting their family member, then the health professionals can direct their care to the family or the carer in that instance.
So have you done research on this? Do you have any data on what patients and family are telling you, or the impact, the evidence that this is worth doing?
Absolutely. So we've looked at all of the data that's come out through the My Health My Way tool, and it was previously called Screen It. And we have over 7,000 entry points of people who are reporting their data to us during treatment. And that's resulted in patients receiving the right care at the right time when it suits them and by the right professional. It's resulted in 25% less outpatient appointments needed for patients. So if patients are doing fine and they don't need to see their healthcare team at that time, then we cancel those unnecessary appointments. So it allows people to spend more time doing the things that they want to do rather than being at the hospital.
And Bena, just finally, where did this idea come from? I mean, as a patient, I'm thrilled by it. Where did this idea come from? Because it takes the hit and miss out of whether someone notices you're in trouble.
Absolutely. So I think we conceptualised the idea in 2013, and we had a feeling that we were probably over-servicing some aspects of cancer care. So we were seeing people too much and they didn't need to see us that often, but we were under-servicing other aspects like the psychosocial elements, so the emotional response to having treatment, the distress, the anxiety. So we wanted to find a way that we could understand exactly what was going on for patients and provide the care for those specific things.
What do you say to a clinician who may say, look, our job with radiation therapy is to save lives or to prolong life, or to prepare someone for a safer surgery. And we simply do not have time to engage in psychosocial focus. That's the social worker's job.
I would say that there is great evidence that supports that using electronic patient-reported outcome tools like My Health My Way is actually more effective than some chemotherapy drugs. If a patient-reported outcome tool was a drug, society would be demanding that we use it routinely every day because there's been increased survival found just by including patient reporting of their own side effects and their own experience of cancer treatment.
Bena Brown, thank you so much. It's such a pleasure to speak to you.
Thank you, Julie.
Well, it gives me great pleasure now to welcome from Princess Alexandra Hospital in Brisbane, Dr. Jodie Nixon, who's Clinical Team Leader, Cancer Services and Lymphedema, Occupational Therapy, and you're also the co-chair of the Princess Alexandra Hospital Wellness Initiative. Thank you for joining us. And what is this Wellness Initiative?
So a group of very motivated clinicians and some consumers started it about 3 years ago. And what we had recognised is we were doing conventional care of our cancer patients pretty well. But when the Clinical Oncology Society of Australia introduced the survivorship guidelines, we felt that we really weren't embedding that wellness concept into our treatment.
What does that mean? Can you explain that you weren't embedding your wellness concept into your treatment?
So patients were coming in and getting the surgery or radiotherapy or chemotherapy that they needed, but we probably weren't really embracing that concept of keeping patients well and active and moving during treatment so that their longer term survivalship would be more successful and they'd be able to do the things that they wanted and needed to do.
Let's talk a little bit more about the Wellness Initiative, and then I want to hear what you're doing in relation to mask anxiety as well. But just staying with the Wellness Initiative, I'm aware that you have hand massage and Delta dogs. I am crazy for dogs, so I'm keen to hear about both. But are they examples of the sort of activities that have flowed from your work?
They are. So at the moment we have been a little bit COVIDised, so some of those programs have had to be put on hold. But we have Delta dogs. They come into our inpatient setting. They usually come about once a week, and Molly is the dog that we're lucky enough to have here. She's a beautiful cavoodle, and it just brings patients such joy, when she jumps on their bed or sits on the chair or the floor with them. Particularly when lots of our patients often have to have extended inpatient stays, so they can't necessarily have access to their own dogs as well. And basically it just has a calming effect for people who are dog lovers. At the moment, the Delta dogs don't actually come into our radiation setting. It is only in the inpatient setting that patients have the Delta dog experience.
What benefits have you seen in inpatient, and are you considering, once COVID allows, extending it to, say, people in the waiting room for radiation?
So, Julie, we have actually explored that. One of our radiation therapists that works here has got a dog that she thinks would be perfect, but there's a lot of logistical challenges with getting animals and pets into waiting room environments in particular. So we've hit a lot of roadblocks with that, but we're a pretty persistent group, so we do have that on our long-term vision. I personally always have thought that you need to have two things in a waiting room. You need a cute gooing baby and a cute puppy dog, and that way you've got most people covered.
More power to your arm. Persist as long as you need to make it happen. But when you talk about a baby or a puppy, what are you really saying about the psychological state of a person waiting for radiation and what we need to try to do about it?
I think it's really scary for people, and most people have never been into a setting like a radiation unit before, and it's not something that's even really that similar to other settings that you may be in. So I think it's just the familiarity and the comfort of having a puppy or something more familiar. Another thing that we do in the setting here is we have knitting and jigsaw puzzles set up in the waiting areas as well, so that people can keep themselves a little bit occupied. And it's really nice to see someone coming in, knitting a few rows of a scarf, putting it down, and then the next day when they come back in, they can take it up and keep going as well.
Fantastic. Now, can you tell us about your initiative in relation to mask anxiety, and perhaps you could just begin explaining what it is and its prevalence for people who've never heard of it before?
Yes. So I've had an interest in mask anxiety for quite a while. I've been working in the radiation unit here for about 13 years, and we involvingly saw how people were really struggling with this. So Bena, who you've just spoke to, convinced me to do a PhD, and that was looking at the distress associated with head and neck cancer along the trajectory of the journey. So one of the phases was looking at the mask anxiety. And what we found is the prevalence here was about 26% of people were quite distressed about having to have the mask. Some of the interesting things that we found is people felt supported by radiation therapy, nursing and occupational therapy around if people were communicated with what was going to happen, and just having that acknowledgement of validation, that was really helpful. But some of the other strategies that patients reported were really useful was having access to music while they were having the treatment in the machines, or developing strategies beforehand around relaxation or distraction techniques that we tailor specifically to that person. So some of the things that we've done in the past is an 18-hole golf course. So you start the distraction by, walking yourself up, teeing off, probably going into the water once or twice or into the sand bunkers, but it's just working out what will work for that particular person. Some patients just count backwards from 40 down, or, it's going to be different for everyone.
And when you're talking about that, you're talking about an inner visualisation, aren't you?
Yes, although sometimes we have recorded ones and then patients can listen to that as well. Again, it just depends on the person and the probably level of experience they bring prior to the treatment.
What have you learnt out of all of this, Jodie? Because you've obviously been a whole journey around the patient experience with the mask. What have you learnt out of it?
I think that often all patients need is just somebody to be a little bit kind, and for anybody treating patients with head and neck cancer, whether it's the radiation therapist, the nurse or the admin officers, that just remembering that this is a really foreign experience for people. It's like walking into a science fiction movie, and just being a little bit kind and patient can make a really big difference.
It's my impression that in many centres, people sort of wait to see how the person goes.
I think it's really important to talk about it beforehand, because it is something that's so foreign and unexpected. Often even just the process of the fabrication of the mask can be enough to unsettle somebody and make them quite anxious and distressed, whereas if they knew what were to expect and were more settled about it, then that may not set off the distress associated with it. In my experience, you've got two different groups of patients, and I can only speak for adults because I don't have experience with paediatrics. But you have patients who by nature are just a little bit anxious, and anything new will unsettle them. So those people will probably be unsettled and anxious about it, but after the second or third session will settle into it and be more comfortable and able to manage it. Then the second group of people are the people who have a true claustrophobia and have often come with a childhood trauma or a legitimate experience of claustrophobia that will make this experience much more challenging for them.
And when you say a childhood trauma, what sort of thing are you thinking?
Again, everybody's a little bit different. Sadly, a lot of people in childhood have been exposed to abuse of sorts, locked in cupboards. We have had a number of patients who've had really traumatic things that has made the experience very, very difficult for them.
I see. So this is, in a way, what you're doing is a kind of trauma-informed care, isn't it?
Yeah.
But Jodie Nixon, I respect and admire your work immensely, so thank you so much for sharing it with us.
Thanks, Julie.
Well, it's my great pleasure now to welcome our third representative from Princess Alexandra Hospital in Brisbane, Andrew Puffett, who's Senior Radiation Therapist, Patient Education, my favourite thing on earth, in the Radiation Oncology Department at Princess Alexandra. Thanks so much for taking the time to talk to us.
Absolute pleasure.
Look, before I go into some really innovative work you're doing with patient education, I just want to get your thoughts on the internal design of bunkers and how we may be able to decorate them or change them in any way to improve the radiation experience for patients and families, the focus of all of this. Could you just begin by giving us a visual description of how you enter a bunker and what you see as a patient for people who've just never been into a bunker?
So a radiation therapy bunker is quite an intimidating space for someone that hasn't experienced it before. Essentially, it's a concrete maze that you walk into. It's very sterile, very clinical looking. And at the end of that maze, there's this large machine which looks something out of a science fiction movie. So when a patient walks in, if they haven't had that, preemptive view of what that machine is and what that look is, it can be quite unsettling.
And when you say a preemptive view, what do you mean?
So one of the things that I've been working on is to, I guess, educate patients about what the equipment is that we use to treat them. As I said, it's quite scientific, it's quite technical, so having to break it down in a way that people can understand I think is very important, because they are lying on a bed each day and this equipment moves around them, and unless they have some sort of understanding in what that equipment is actually doing, it can, I guess, give them a sense of anxiety.
And does it make a noise, the machine?
It's very loud, the machine. I've never been in the room, obviously, when the machine's on, but from what patients tell me and what we can hear even outside, it's kind of like a buzzsaw sound, a high electrical piercing sound.
You were so deeply moved by the challenge that some patients experienced. You created something out in the waiting room of Princess Alexandra Hospital that I've been lucky enough to see. Can you first explain that pedestal, what's there and why you created that, and then we'll move on to how you've developed it?
So it's essentially an information kiosk that we have for radiation therapy patients. And I guess the idea was I wanted to familiarise the patient when they came, before they walked into that room, what they'd experience and what they'd see. And it uses an interactive touch screen. So it gives them a sense of control. So when we show them the linear accelerator or the treatment machine on the screen, they can manipulate all the components that we would as a radiation therapist. So by touching that screen and moving the components, they know, oh, this is what that does. It's not going to hurt me. It's going to take an image of me so the radiation therapist can line me up more accurately to give me that curative treatment.
And you, as part of being inducted as a patient at Princess Alexandra, do you show them this kiosk and explain what it's about?
Yeah, so when they walk in, our nurses or the radiation therapists will essentially stand them in front of the kiosk and they can swipe through the different slides on the actual program, and some of them will talk about the CT scanning process when they come for planning, and the others will focus on treatment. We also familiarise them with the staff, so we've got a really good allied healthcare program here at the Princess Alexandra Hospital, and it's one of the strengths of our radiation therapy unit because we can give patients that extra care they need. So we let them know those different support groups straight from the get-go so they know where to seek help.
My memory is that you actually see the pictures of people and like a little bio, you know, it really briefs the patient and the family member on who's who in the zoo, I suppose you'd say.
Yeah, exactly. And all the allied health groups get like a little 30-second advert for themselves to advertise what they do, because when someone comes in, they don't necessarily know what a speech pathologist does for their care. So by letting them know that, when they have issues, they obviously can walk and talk with that person.
Well, just before I go to that, and how does that placement of all that visual information in the waiting room assist the family?
So when a patient's actually having their treatment, we don't normally take them into the bunker to show them all the gear and explain what's going on. So that 10-minute process where they're having their treatment, the family member can wander up to the kiosk and have a look through it and get a sense of what's happening and how we're taking care of the individual.
And how will that help the family member?
From my point of view, I think it's more about, it opens up a door for conversation between the family member and who's having treatment. It gives them the ability to communicate on a similar level using similar terminology, so they can describe the experience and talk about any issues they're having.
And Andrew, you mentioned 10 minutes treatment, but some of us are longer, aren't they? I mean, mine was 20 minutes, so some people can be in there for a while in the bunker.
Yeah, it certainly does vary. On average, we tend to do 10-minute treatments, but it can be anywhere up to 40 minutes depending on the condition of the patient.
So tell me what you've done next, because you've gone on to interactive e-books and to things that you can look at on your phone. So tell us about that.
So what we wanted to do is to give a tool to the clinicians to let the patient walk away and have accurate information that they could read through in the form of an e-book on their mobile device.
And how's it going?
It's early days. So one of the things that we found is that there's that barrier with technology still, but the demographics changing. So the elderly population still are relying on their family members to download the app and install it, things like that. But as that transforms over time, I can see the tool becoming more valuable and more used. So we're running about probably 35 to 40% of usage with our patients at the moment.
And do you have a print version of this material as well, or would you offer them the Cancer Council booklets?
The Cancer Council booklets are used. We don't offer a print version of the material. My belief is that if someone can't access that material that we've got in that digital space, they need that one-on-one chat, that one-on-one care. And I think that's very important not to move away from. You can put pieces of paper in front of everyone and make them read it, but I think if you can have that one-on-one interaction, you'll always have a better outcome with a patient.
And just 2 or 3 of the characteristics of this tool you've created, these interactive ebooks that you're particularly proud of. I mean, as I understand it, you can direct people to a particular patient pathway. They've got multimedia dimensions. What are the aspects of it that you're proud of?
So we're building multiple modules. So like I said, it's early days yet, but the idea will be that we'll give patients information that's really specific to their particular case. And an example would be, at the moment, we have quite a few Chinese patients that come through, and we've got a section in the app where they just push a button and it translates content about one of our programs, Deep Inspiration Breath Hold, into Mandarin Chinese, and they can access that content. And we're doing that for multiple languages. Fortunately, we've got quite a few people in the department that speak a range of languages, and they're spending their time translating for us.
You raise a really important point, because the great value of visual information is, even without the translation of the words, people can gain a lot of information from the pictures.
Yeah, certainly a picture tells a 1,000 stories, doesn't it? And that's important because we have such a limited time with a patient. If we can get that information through in a way that they can interpret, that doesn't necessarily rely on language, I think we can make good inroads into removing that anxiety from a patient's journey.
Well, look, just finally, part of what we're looking at in this series is how the visual design, the internal visual design, can improve the radiation experience for patients and families. And I've been into a lot of bunkers now since I had cancer, and they vary enormously across Australia and across the world. So some have coloured walls, some have very interesting kind of images with backlighting, that while you're lying on your back you can actually be in a forest or in a fish tank or whatever. Just your personal views about what degree decoration, to make it look less clinical, may assist the patient.
Oh, absolutely. The bunkers are overtly sterile by nature. So if you can have wall art, anything dynamic that's a distraction is always helpful. So you're talking about sky panels there before. Just bringing that outside world into that bunker space makes you automatically feel calmer. Even from a treatment point of view, as a radiation therapist, I prefer to have some natural light feel in that room because I'm in there all day as well. So that helps. Having audio, good quality sound systems, and even just as you walked in, we at the moment, we've got a wall that's sort of got a big photo print on it of a creek scene, and that provides that calming sensation as well. But having something dynamic on a laser projector on that wall, so it can change the season or change the scene, and it gives that person every day they come in something different to think about.
And the emphasis I'm hearing there is on light, on nature, on colour, and on something that varies. Are they the key elements you're trying to recommend?
Absolutely, yeah. You definitely want that nature feel in there, bringing that outside world into that space.
Andrew, it's just been so fantastic to talk to you, and I just want, on behalf of patients and family, personally thank you for the innovation and passion you've brought to the visual education of patients and family. It's a truly marvellous thing you're doing, so thank you.
Thank you very much, Julie.
And I'd like to personally thank, in addition, Tanya Riviera, who was the camera person in Brisbane, who did some beautiful work there, I think, in bringing us Princess Alexandra Hospital in Brisbane's work. And I'd also like to thank quickly Daniel Taylor from Inside IT, who is the magic man behind the scenes, who's making these marvellous webinars, but also our post-production YouTube videos, and they are really worth having a look at, and I hope you'll help promote them and share them with our colleagues. Well, look, we've got an opportunity now, before we finish, to get some varied comments. My apologies to everyone for the brevity required, but let's have some reflections on what are we going to take away in terms of valuable ideas, both from Princess Alexandra Hospital in Brisbane and also our earlier look at the Christie Proton Therapy Centre in the United Kingdom. Let me come first, if I may, to Thomas Masullo from Woods Bagot and also Rosina Di Maria from Woods Bagot in the architectural team working on the inside of the future Australian Bragg Centre for Proton Therapy and Research. Thomas, what are you thinking about? What are the strengths there that you'd say, yeah, that's what we were thinking of, or something you'd like to reaffirm, or whatever?
I found that session really, really interesting, because to me, the thing that was really resonating was this whole idea about demystifying this process, this black art, this black magic that happens behind this curtain. And I found that to be something that was not only something that we had to address as designers, but also an opportunity to create a positive experience. So moving from this idea of a patient-centred care to something that was a very tailored experience for the individuals, not only the patients, but also their families and their carers. And I think we heard some of those examples in PA, right, from My Health, My Way, in terms of how we might do that, embedding wellness into what we do in every single way, and the education programs that we just heard about as well. So I think Rosina spoke a little bit about that particularly, and I think having a number of those touch points along the way, and the journey starts outside of the facility, and I think that's really, really key, because we keep focusing on what happens in the facility.
I guess I'm interested, and I'll just stay with you, if I may, Thomas, for a moment, and then I'll come to Rosina, on particularly the design features you're thinking about, because I feel so far we've heard a lot about nature. I can't remember the amazing word that Rosina uses, but she'll tell me it again in a minute.
Yes.
Say it again.
Biophilia.
Biophilia. I love to learn a new word. But, you know, they're talking about bringing nature in, they're talking light. I think in the paediatric context we've got a lot of animal themes. You know, what are you thinking of in specifics? Also this issue of whether to decorate bunkers, because I've seen bunkers. If you Google, by the way, guys, go to Google Images and Google radiation therapy bunkers or proton therapy bunkers, you will see some that don't look clinical at all.
Yeah. I think one of the key design features that we have created is we've separated that front of house from what I call the back of house treatment areas, and they are on different levels. So when you present it to the building, it's a very public entry. There's a lot of light and double height spaces that one enters into. And when you enter into the treatment reception space, as we call it, it's quite a relaxed environment with a number of different settings in there. And again, talking about all the things that we've heard today, there's connection to the outside as well, directly off that space. So again, there's this direct connection to respite spaces that are external to the building. And then there's some very discrete entries down into the treatment area. And then once we're in the treatment area, we start the journey again, and we start personalising that process again. So now I'm in the treatment area, now I've got a reception counter, there's a different waiting experience, and there's a different way that we now proceed through the space into the bunkers. So I think there's a series of touch points all along the way that we've created and co-creating at the moment.
Thank you so much. And Rosina, a quick comment from you, the key message you want to give those passionately listening and wondering what you're going to do with the Australian Bragg Centre.
It's a big question. What we're going to do is create an integrated environment. I think there's a lot of examples where nature images are attached to walls and kind of still presented, I think, in a healthcare way. We're bringing our knowledge and working with the lifestyle sector, such as when we do work for Qantas clubs, into this kind of thinking so that people have a total integrated design response to an experience, not a healthcare environment with a few touches of that.
If I could just burst in, because I've got so little time with you, but I'm lucky enough to have spent a lot of time in Qantas clubs and less lucky to have spent a lot of time in a waiting room of outside radiation, 30 days straight, when I was full of fear. And I suppose what I'm hoping we've managed to bring through our allied health colleagues, particularly in that session from Princess Alexandra, is the immense psychological trauma that we're facing in anticipation. And I don't think it's an easy gig as a designer to help us settle down and stay as calm as possible. That's just a comment, really.
It is, but it's a privilege. And for us, we take it very seriously that we can bring all of our global thinking and how really successful spaces work for human experience into this. So we're bringing all of our, I design hotels as well as Qantas clubs as well as healthcare environments, because if you remove the barrier of the tag being a health environment and you actually design a space for human need, you can actually soar, and that's what we're hoping for. And
I was thinking a lot of people are scared of flying too, so there is a link. There are I mean that quite seriously. True. People do have fear of flying. If I could come to Associate Professor Peter Garaysky, radiation oncologist, Royal Adelaide Hospital. It's cruel, Peter, but just 2 or 3 quick comments. What should we take away from Princess Alexandra?
PA Hospital are some of Australia's leading research groups with regards to patient-reported outcome measure capture using mobile technology. So I think the work that Dr. Brown is doing is fascinating. Why that's relevant for the Bragg Centre is because it will be, at least initially, the national proton therapy service. So we will be treating patients from all Australian states and territories. So patients will be coming far and wide. And I'm very fascinated to see that these PROM captures may actually translate into fewer clinic visits into the future. And that's important for us because we'll be treating centrally, but these patients, after they have their proton therapy, will go back to their home states. And so this will be a unique way to track them alongside their primary healthcare providers and their specialists back home. And then the other thing just quickly is this concept of wellness. And also going back to the Christie, I love this idea of a bespoke shuttle bus and also patient accommodation located centrally. And that's important here because Australia, the Bragg Centre is going to be literally on North Terrace in Adelaide, which is in the CBD. And luckily we have lots of facilities around for young children and young adults, including the zoo, the Adelaide Oval, commercial districts, parks and playgrounds readily available. And then the Children's Hospital, where many of these patients will have their chemotherapy managed, is only a few hundred metres away. And so is the Royal Adelaide Hospital, the main tertiary centre for adult care in this city.
I just want to say that Jodie Nixon, the occupational therapist from Princess Alexandra, was very keen for me to emphasise that exercise is a big part of their program too. I'll just make a comment. I don't have time for a response, Peter, but in the 7 years since I was treated, and I've been visiting multiple bunkers as some sort of mad, obsessive patient advocate, it's a way of dealing with trauma, at least it's constructive, I've noticed that it's really hard to keep the space you set aside for patients. It gets eaten by offices and consulting rooms. So it's not just making the space for patients, it's keeping the space as time goes on. But Dr. Bena Brown, now with the Menzies School of Health Research, speech pathologist by background, and we saw you on the video. 2 key comments. What's the message to our designers who are listening to you now, working on the new Bragg Centre?
I think for me, what I've taken away from this session, which has been wonderful, thank you so much for coordinating, Julie, and thanks to all the great speakers, is 2 things. One, establishing, maintaining, and really committing to developing relationships with people coming in for treatment and their families. And 2, bringing the outside in. And creating a welcoming, comfortable, safe space. So I think if you get those 2 elements right, the people element and the design element, then you've probably got a winning service and a winning model of care.
And we've got to help. I love Jodie Nixon mentioning kindness, but we've also got to get those dogs into the public waiting rooms, because I think it's a staffing issue. It's as Phyllis Butow, who I'll come to now if I may, Professor Phyllis Butow, School of Psychology, University of Sydney. You mentioned earlier the importance of staffing in order to allow radiation therapists to notice we're upset and get us some kindness. One or two last comments from you before we head off to Rare Cancers Australia.
Well, I'd really reinforce the importance of hearing about the patient experience, and one way of doing that is through patient-reported outcomes, because people often feel like they are so grateful for their care, very aware that health professionals don't have time, so they don't raise these issues. And so the patient-reported outcomes allows them an avenue to do that. But also, and we always used to train our young medical staff to do this, to just say, for people to say, is there anything concerning you today? And is there anything else concerning you today? And by that time, people generally are able to raise issues. So the importance of that human element is just so critical.
And such a good, simple question. The only thing I'd add is maintain eye contact while you say it. Because sometimes as patients, these people who we grow to love, you do love people because you want them to be good. You want to believe they're going to help you survive. It's very hard to interrupt their busy day with whatever's upsetting you. Now, I know some clinicians watching this will say some people have no trouble interrupting me, but some of us do. Look, I'd like to also just acknowledge the work of Deb Page from the Australian Bragg Centre, who's been absolutely fundamental, along with Daniel Taylor, Inside IT, in creating these webinars. There will be 3 next year. Make sure you register on YouTube. You go to YouTube and you put in SAHMRI, South Australian Health and Medical Research Institute. That's the acronym. Put in SAHMRI and Bragg and it will come up, and we'll send you links. But before we finish our second webinar, our webinar consultation for 2020, I want to welcome from Dr. Amanda Ruth from Rare Cancers Australia and the National Oncology Alliance. Amanda has a PhD in immunology, and Rare Cancers Australia are a partner in our broadcast today. Amanda's Head of Policy and Public Affairs. Amanda, what is Rare Cancers Australia? What is the National Oncology Alliance? And what is this all-important report you recently released, Vision 2030? How does it link to what we're on about today? Welcome.
Yeah. Hi, Julie, and thank you. Look, it's a pleasure to be launching this video series with you in partnership. It's very encouraging to hear what everyone has had to say about how important the patient experience is, particularly around even sort of subtle nuances such as, visual aesthetics and how that can impact patient wellbeing and anxiety levels. Look, at Rare Cancers Australia was established 8 years ago by Richard and Kate Vines. Kate is a 30-year survivor of thyroid medullary cancer, and to this day there are no subsidised therapies available for this type of cancer. At Rare Cancers Australia, we advocate for patients with rare and less common cancers and help them to find the voice. Also, particularly, we offer patient support so that patients can have the right treatment at the right time when they need them. And one of the sayings that Richard says quite often is that treatment delayed is treatment denied for patients, and often they can't afford to wait. And this for treatment because it means that obviously there's, very little hope for future. So in saying that, we've really grown as an organisation and also in our areas of advocacy, and we embarked on a project through what's called the National Oncology Alliance. Now, the National Oncology Alliance was established by Rare Cancers, or founded by Rare Cancers, and it is slightly broader than the Rare Cancers Initiative in that it considers all cancers, common cancers as well. And it's really an advocacy arm that seeks to ensure that there's equity of access to the best emerging technologies and therapies for all Australians with cancers into the future. And obviously a huge part of this is radiation therapy and the area of radiation oncology, which from what we heard through numerous workshops that we conducted over the last year is that it's underutilised in Australia. And this is a real disappointing factor for patients because, as we've heard, radiation oncology has so much, or radiation therapy has so much to offer in terms of potentially better outcomes for patients. It's also relatively safe compared to other treatments. But, from a government and funding perspective, we know that once all the logistics are established, that it's actually cheaper and cost effective. So it's quite often overlooked. And part of that is because I think there's a general consensus that it's an older type of treatment. And what we've heard today through, the delivery of proton beam therapy through the Australian Bragg Centre is that, there are substantial advances in this technology in delivering precision therapy that promises better outcomes for patients.
And Amanda, I'm so sorry, I'm going to have to come in, but I'll also, first of all, just thank Amanda Ruth from Rare Cancers Australia and the National Oncology Alliance, and we will put links through all our social media and our YouTube. And I also just want to emphasise, as we said at the beginning, that there's also very significant and ongoing advances with what is sometimes referred to as conventional radiation therapy, the sort that I had. And for many patients, conventional radiation therapy, which is more targeted and sophisticated and new developments all the time, will for many years be the treatment of choice. And then for some, it'll be proton therapy. Sorry, I had to bang in there, Amanda. Okay. It's the nature of the beast. But
can I just say before I get cut off, if you'd like to learn more about the report and the work we do, please go to our website at www.rarecancers.org.au and feel free to contact any of me or the contacts on the webpage. Thanks a lot, Julie.
Thank you so much. And I want to thank everybody who's been with us. Remember that we have a YouTube channel. Just go to SAHMRI Bragg and you'll find it in YouTube. Can you please subscribe? It's free on YouTube, and that's the best way to keep in touch. Comments are very welcome. We'll send you a survey, and there are 3 of these webinars next year. We'll have increasing diversity in both clinical, patient and family participation. So thank you so much for being with us, and farewell till 2021.